Hello doctors, have a beautiful day. This is Dr. Hub, a passionate doctor mentoring worldwide. Inheritance pattern, that is nothing but the X-linked recessive. So this includes the L. L stands for the Leach-Nyhan syndrome or also the Lowy syndrome. Next, there is H. H stands for the Hunter syndrome as well as hemophilia. Okay, easy way to remember is when you hunt there is blood, so it is nothing but hemophilia A and B. So Hunter and hemophilia. Next comes C. So in C it is nothing but the chronic granulomatous disease. And there is also G. G for the G6PD deficiency. So if you see C and G, they look similar. So first C for chronic granulomatous and then G is for G6PD deficiency. Next, there is CD. There is another C. This C is for the color blindness. Next, there is D. So this D is nothing but for the Duchenne muscular dystrophy as well as in case of the diabetes insipidus. Then we look about A. So what is in A? So A includes A gamma globinemia as well as there is Alport syndrome and also the ocular albinism. Next comes F. So this F, it stands for the Fabry disease. And next comes W. W stands for the Wiskott-Aldrich syndrome. And looking at other miscellaneous conditions, this includes the Menkes disease as well as the ornithine transcarbamylase deficiency. So just to recap everything, firstly we saw the Leach-Nyhan syndrome and the Lowy syndrome. Then we looked at the letter H, which includes the Hunter and hemophilia. Next we saw there is C and G. The C stands for the chronic granulomatous and G for the G6PD deficiency. Next we saw C and D. C is for the color blindness and D is for the diabetes as well as Duchenne muscular dystrophy and the diabetes insipidus. Next we saw A for, there are 3 A's. So there is ocular albinism. Next there is also the A gamma globinemia as well as the Alport syndrome. So moving ahead, we also saw the letter F. F for the Fabry disease and W for Wiskott-Aldrich syndrome and other miscellaneous such as the Menkes disease and the ornithine transcarbamylase deficiency.